Okay, so we are ready to rock and roll, and let's get started. So, Barbara, it is Mental Health Awareness Month right now.
Unbelievable. What great timing that I'm here at this time in this place.
Absolutely. So, what we're doing today is we're going to be talking about basically the basics of therapy. Yeah, we're going to talk about the basics, what to expect, how to choose a therapist. So, before we get into it, let's just let you introduce yourself. Tell us a little bit about yourself.
Well, since we're everything Jersey City, I've lived in the county of Hudson for 25 years. I don't want to age myself, but it's been a long time. So I've been here long enough to be somewhat of an old timer. It's an historic town. I've made it my home. I've raised my daughter here. She went through the Jersey City school system here. And I've been a clinician for a long time, working in the field of community mental health, providing services around emotional wellness to a lot of populations, from kind of chronically mentally ill, head injury, people with AIDS and HIV, folks that were needing individual psychotherapy, couples and adult individuals, always adults for me. There are groups of clinicians that work with children, but I have always worked with adults. And my focus has been, early in life, was a rehab counselor, so that I was working with bringing people into the workplace despite maybe their illnesses or physical problems, and letting them remain productive in the workplace. I've always thought that work was very important, is the work of adults. Staying employed is the work of adults. So that's been what my focus has often been, but it's kind of morphed over time.
So that being something that you focused on so much, it's kind of perfect that we're here. So many people right now are juggling this this thing with quarantine and working from home and trying to adapt to an environment that they've never even considered working. A lot of people don't work from home because they know it doesn't work for them, and now they're forced to do it. So it is really incredible that we have you on, so we can probably touch on that a little bit today too.
Yeah, life in the workplace. It's an amazing time. And, as a therapist, I'm kind of adjusting to everything. I'm living it myself, and I'm helping people do it at the same time. So it's a wonderful time, a rich time, and it's extremely difficult. As
Right.
someone who has been worked to help people find solutions, this is the challenge of a lifetime, of a century, right? For
Right.
all of us.
Right. So guys, if you're just joining us, I wanted to let you guys know that down below there is a little question mark box. And if you have a question for Barbara, go ahead and push that question mark box and ask her whatever question you have that's on your mind. We would love to hear your questions. So if you have anything, hit that little question mark box below and enter in your question, and we'll try to get to all the questions today. Also, right next to that should be a little arrow signal, a little arrowhead, and that is to share our live stream right now. If you know anyone who you think might want to tune in, ask a question, or hear what we have to say, please go ahead and push that little share button at the bottom that looks like an arrow and send it off to a couple people that you feel like might want to tune in right now. So we will go ahead and get started. And again, if you guys have any questions, you can write them in the comments. We will see them in the comments, but to make sure I don't miss any questions, putting them in the question box also really, really helps. Hi, guys. So first of all, to everyone watching, how are you guys doing out there in quarantine? Are you feeling mentally healthy? Are you feeling drained? Um, you know, how are you guys dealing with quarantine? I would love to see your comments and what you guys have going on right now.
Yeah, I think there's hopefulness, hopefully coming from folks. Like, their hopelessness is always kind of the fear that clinicians have, that and that's hard to see when we don't have end in sight. So we keep on rising and being very resilient, or attempting to access resilience, and then it kind of goes away from us. So, and to be at the mercy of our leaders, that we're not sure if they see us and understand how we're feeling and understand the challenges of families. I think that the quarantine has laid bare the impossibility of working families, whether they were mighty or meek. it's really hard to raise a family and to work full time and maybe to commute across state lines or commute an hour. And so we're always running. We weren't running on empty, but we were running often close to empty in terms of energy. And the emotions really feel the impact of that stretch.
Well, I see here a couple of people have written in that they feel drained or
Yes.
stagnant and a loss of resilience. And I'm sure this is something that a lot of people are feeling. And guys, do not feel alone at all in this. I feel like this is definitely something that we are all on the struggle bus with. So Barbara, what would you say to the people who are kind of feeling this stagnant, drained energy right now?
I think it's very normal, and I don't have any strong solution because since I don't, there was always a time when I had a lot of information. This too shall pass. This is a long time for something not to pass and to be kind of followed with bad numbers. But I think there are many things from the past that people are turning to. They're turning to embroidery. They're turning to gardening. They're turning to baking, so that soothing and strengthening activities that are multisensory and that are not so with baking, kneading, seeing the beautiful frosting. So we want to do smelling flowers, seeing flowers, hearing music, jumping rope, breathing, meditation is something old school and yet it's very necessary. So you just want to keep your body moving. The moving body, active breathing is healing. So you want to, breath. What happens is emotions are really a brain function. The brain has all kinds of chemicals that it shoots out when it's stressed. It's stressed or overwhelmed. It tells the body to do certain things. It tells the body to stop sending blood to the heart center. It takes blood away from the brain. So that chronically is often what I see in folks. And you literally can't think straight when your brain is telling you danger, danger, danger. And our brain,
Right.
yes, and so our brains have been told danger, danger for a very long time, for many days, and yet there is hope all around us, or for many of us, there are hopeful moments, hopeful activities that kind of take the sting. So that are we stung or have we skinned our knee of our lifestyles? Absolutely yes. But many of us have traditionally done things or done things as a child that we found very useful. Reading, developing a reading group or joining a reading group or reading on your own, painting, doing a little watercolor, doing a little sketching. I think to draw back to your younger self and those leisure activities.
That's what I was kind of thinking when you were saying like jump rope and paint. And I was like, oh, so basically do everything I did when I was a kid before technology hit. That's what I should be doing.
Yeah, and also that we're leisurely, that we're satisfying, and that you both could do by yourself for a bit, and then you could join. And there will be a time when you will join. So for those people that are jumping rope, you'll be the best jump roper in the world. Like you'll be hitting it, and they'll be, hey, my name is Adam, and I like apples, and I live in Alabama. Like you can go back to all that stuff of a better time.
Yeah.
It won't harm you. To retreat back to joyful self won't harm you, and it's a good way of surviving and really thriving. Do a little jump rope. I know I'm doing jumping jacks and push-ups, and then I hit what needs to be hit. So it's really building that resilience. Our foundation has been shaken. So we've got to do soothing and strengthening activities to make sure our foundation is sound, and that then we begin to think better.
Right, exactly. I think another thing is it comes in waves a little bit. How one day you'll be having a good day and the next day you're just like, I don't know how to make it through this day. It's just dragging on forever. How long is this going to go on? But the good thing that has happened is I feel like I've had a little more time to commit to things that maybe I didn't have time before, like gardening or picking up crocheting a blanket that I started 3 years ago for someone's baby who never got it. So I have a little more time to hone in on those things, and that brings a little piece of satisfaction, the fact that I get to get these things finished, because when things are left unfinished, you kind of don't feel good about it.
Sure, sure. There's a lacking, or there's a place that we put the things that we left undone, and that's disappointment. And there's a little bit of there's a negative emotion. It might be shame. It could be anything, and that kind of, now you don't have to worry about that because you can finish everything. You can learn a new language. You can do a
Yeah.
lot of things that were left undone that will really serve you and your family. Or everybody can do that.
Absolutely. And then, guys, just so you know, it's just reminded me, everythingjerseycity.com came out with an article, I think 2 weeks ago. And the article was a list of things that you can learn in quarantine, whether it's learning a language or learning to dance or learning to play the guitar. So, all of these suggestions on things that you can virtually learn via YouTube or from local businesses that have gone virtual. So definitely check out that article if you're interested in just kind of like picking up a new hobby or learning something new. I want to look in here. I have a question that came in, so I'm going to go ahead and pop it up right now. This question is from Abby. It says, how do you recommend keeping a schedule for structure without getting bored?
It's interesting. See, I use a book. I have a date book, and my day is planned by the hour. So I'm like never bored. In fact, I'm like frantic looking at those little things in on my body. So I don't make it up every day. It's kind of, I go ahead and really commit to it. I find that paper and pencil, that kind of old school, and there's something very visceral about the action of committing to it as you write it out. To me, that's kind of the therapist way. Many of us, not all of us, but many of us still have a date book that we use.
Right.
And to kind of mix it up in terms of soft and hard, or, you know, glancing out the window and then going back to the work. So the cadence of our worlds may have changed, but our ability to be productive has not changed, and our ability to have meaning in our life has not changed. We may have to glance back to the old, but that is to buoy us towards the new.
Right. So we had a comment come in. It says the hardest part is that we are programmed to fight or flight, and we are asked to do the opposite, which is to sit still. We've fallen away from sitting still, and it now seems foreign. And that walks really help them. And I think that's true. I think just taking a walk outside and breathing fresh air and being around nature really helps. Like
Sure.
you were saying, the way that oxygen works and your brain works, being active really helps you right now.
And we can walk, and we're like, walking isn't weird for Jersey Cityans. It's part of our who we are. It's in our DNA. So when you're walking, we have many parks in this community. You know, Jersey City State Liberty State Park is our backyard, Jersey City's backyard.
And Liberty State Park just opened last weekend,
exactly.
So you can walk around Liberty State Park now.
Yes, yes. So the oxygen and getting it throughout your body. So as you're breathing, whether you're walking, when you're walking, which can be an active meditation, just make sure you're breathing almost into your hair and right down to your toes. So the act of breathing fully, as opposed to breathing like gulping, you know, so that is telling brain all is well. You know, that the chemicals that are about fight, flight, fear, or disappear, that are our lower reptilian brain, when that's happening, we don't think straight. We're not able to conjure up hope, and emotional intelligence and cognition are like jammed. So our not be able to think straight, not enough air, not enough nourishment, body thinks something is really wrong. That being said, we know something really is wrong, but we don't want to be fleeing or catastrophizing it. We want to have it in its right place, and we want to be productive. You know, we need to be part of a new world. Each and every one of us, each occupant of the city of Jersey City has value. We know that, we see them, but that means the breath, the walking, the soothing and strengthening activities are going to give us emotional wellness and emotional courage that we may not have ever thought we had.
Right. Okay. So guys, if you're just joining us, again, there's a question box down below. If you have a question, just go ahead and pop it into that box and we can go ahead and put it up on the screen and answer that question. Barbara, so one of the questions, the number one questions, because we did put out a little feeler to get some questions and what people want to hear about. So it was, should you see a therapist? Now, I know a lot of people, there might be a connotation that something has to be wrong with you to go to therapy. So basically, maybe we can talk about that a little bit. Why should someone see a therapist? What is the good time, or when will we see a need for it?
Well, transitional times in your life. I've seen people who are, there's an emergent situation or there's a difficult transition, moves, recent divorce, change of job, demotion, so that this is really a critical time in the life of an adult. And so you can have this event and not feel anything, or you can have this event, and certainly the death of a loved one, a family member, whether it's a complicated death or, you know, someone who's very old dies peacefully in their sleep, that can still have an effect on you.
Right.
So emotional distress, you know, emotional dis-ease as opposed to disease is really not sleeping well, not concentration, poor functioning on the job, irritation, removing yourself from your family members, and of course the kind of you know, imbibing too much alcohol or illicit drugs, kind of moving away from yourself because of pain. And then, you know, I also have an addiction background where I work with people with addiction disorders. So I've seen people that know that addiction or, you know, substance abuse is now a problem for them. And sometimes people need to go to facilities that are for addictive disorders. So I've done that as well. But I often work with the worried well. They're functioning and doing well.
The worried well.
The worried
I like
well.
the
Yes.
worried well.
Yes, yes. So folks that know that their functioning has dipped for some reason, or sometimes they know the reason, it's an episodic event, or sometimes it's kind of a slow decline and they're just not comfortable within their own selves. They know that they see a better sense for themselves or better times for themselves, but they want a guide in accessing them. So I'm one of many healers at this point, but you know, it's kind of like, should you go to therapy? It's kind of like asking the shoemaker, should you wear shoes?
I love that. Yeah, like we should all wear shoes.
But therapy, because of the history of this, where there's no hope. You know, we are in the kind of 100 years when 12-step programs were invented, and there was a way to get past addiction. And then medications were invented that helped with psychosis, but had terrible side effects. So,
right.
you know, so this is only after the last 100 years that therapy was something that was accessible to the public.
Right.
And many people could go to a therapist, and it wasn't forever. I tell people that don't worry, because you're not going to grow old with me. I'm going to grow older, but you won't be here. So,
right.
so don't worry. You know, I'm not keeping you, but we're connecting. There'll be a deep connection that will be useful into the journey of your better actions, better productivity, strong and loving connection. So we're going to work until you say we're done. And when you're done, you know, we shake hands, or we used to shake hands, and then off you go. You know, off you go back into your world. So the cadence can be, for many people, we start with an assessment where I ask a lot of questions to get an idea: is this a now event, or is this a chronic event? Have you always been dogged by these problems? Because that kind of indicates how I'm going to work with you. And then we go to so we might do a lot of sessions in a row, like 6 or 7. Sometimes at 6 or 7, some folks are done. We call it a short-term model. It could be 7 to 10. It's a very, very short-term model, and sometimes that's what people want. But longer term, then we begin to go to the cadence of perhaps every other, and every other week can go on for many years, you know, or a year or longer time. You know, I think that
basically just assessing how that person is doing and how that person is progressing in the in therapy or in the program.
Well, assessment is early. Those first sessions are really a lot of questioning to say, who are you? What are your strengths? And what is troubling you now? How did you get to this type of trouble? Has it always been there, or type of concern? Or is it something that's developed recently? So the chronic or the real episodic. So we assess that in our first sessions, and we're doing a
Right.
lot of assessment to develop a goal that meets the need of the person before me, so they know where we're going. I'm very much into, clear goals, under behavioral goals, observable goals, achievable goals.
Okay. Yeah. I have Emily asked, what is something I can do day to day to help improve my mindset? I feel like that kind of goes back to the breathing, maybe, or do you have anything else that you think is just, we talked about breathing and exercise. So was there anything else you can think of?
I think some kind of activity. I think we all know that we're going back to activities that we left behind. Um, and also, strong network, your network of friends and family is also very good. Reading improves your mindset. I think to try things you have tried before, you can do a blend. You can try some new, you can go back to some old, and kind of blend back and forth between the two of them. My mentors have told me that the human being before me, knows themselves quite well. And these are times when the stickiness of hopelessness can be with you. So
Mhm.
I don't know how much any therapist can move it up in terms of this coronavirus, but
Right,
if you go from 0 to 3, look at that as an improvement. You
right,
may
right.
not get 8s in terms of your happiness, but if you're at a 6 about now, our reality that we're not seeing or doing, that we've been stripped of that means so much to us, donuts, walks, flowers,
I love how you added donuts that mean so much to you.
bath gel, meatballs. I mean, we are missing so many things that we thought were important to us, but stripped clean of yourself. If you're stripped clean of yourself or of externals, there's an internal part of you that will light up
Mhm.
when you feed it. And it can start with a meditation practice, a good breathing, good sleep hygiene, make sure you're sleeping well, connections to other stimulating activities that are soothing and strengthening. If you're doing that within your day, at this point, you're really doing the best you can as a human being.
Right. And just celebrating any step in the right direction. Don't
Yeah.
be disappointed if you're not at your goal in a day or two. Accept any step in the right direction as a win.
Yes, absolutely. The 2s and 3s and 4s are fine, and look to the next day is a possibility. I'll get a little bit better. It's a sunny day, so everyone should be looking outside. Everyone should be doing their daily or every other day walk. Today is the day. Everyone
Mm-hmm.
should be looking up I also look at nature, and there is green and nature around us in Jersey City. Many blocks have wonderful flowers that are blooming. Find that mystery of that the world is still going on, even though the world is not going on.
Yeah, I definitely think that it's good to get out of the house when I'm sitting in the house and have no reason to leave, to force myself to get out of the house and take a walk, even if it's a 5-minute walk around the block, kind of just gives you like a little rejuvenation real quick. Like, okay, breathe some fresh air, change of scenery. I feel a little better.
Right. And the brain, and so the brain has a way of recalibrating that, to look at those flowers and to see how pink it is, how pink one is, somewhat pink, one is not so pink. Like, now is the time to really take the moment to allow your brain to heal, because it is working very hard to keep us afloat during this time. But you need to kind of give it a superfood, give it an eye candy.
Absolutely. So one of the questions that came in earlier this week when we were putting out our feelers, I think we already covered that. So what will a therapist share about their personal life in a therapy session? And you know what, that I feel like sometimes in therapy, does it ever seem like a person is getting, so comfortable with you, they're like, but you're my best friend, you're my best friend. So like
Um,
what is the relationship, what is the patient therapist relationship, you
Well,
know?
it's really driven by ethics, and I am very comfortable with human beings and sharing their journey, and yet there's boundaries. That I only share my personal story to the effect that it will add to the healing of my client.
Okay, yeah.
Now, some people are kind of good at that, good at kind of nosing in on me every now and again. They catch me off guard. But basically, I am kind of flat and distant person. It's funny because I can, and this is what I choose to do. I'm distant personally and yet very connected to them, very connected to their story. I think that some people feel that they're fair, and I'm warm and loving, kind, I'm all those things. But there's a neutrality about who I am that I think is just, that's how I was trained. We are trained to be kind of empty personally so that we can really walk the path of another person's life. It's so important. And I have found that it's been very useful. Now, I live in Jersey City. I've lived there for 25 years. So there's some things that lots of people know about me. It's just easy to find out. But I really try and keep, it doesn't necessarily serve the client before me. Not at the door, it's 120% their time.
Absolutely. Yeah. Well, while we're on that subject, another question that came in that just sparked me is somebody was asking if the information is confidential. So when you talk to someone, is that information shared with other people, or what is the situation there?
So it is absolutely confidential. Now except if you're a danger to self or others. So that means that I must keep you safe, keep your family safe. That's the only time that I have to take care of that. And over 30 years, there's been many times, there's been very few times where I've had to take care of a person that's in emotional trouble and may harm themselves. I have had it happen, took care of it. But, you are protected. Your data is protected. The notes, I take notes from my sessions to keep track of what's going on. But no one knows when you come, if you're there. I can't confirm if you come or not come. You as a clinician, as a client, have the right to release your information for collaboration with your primary care physician or with your physical therapist. So you can ask me to collaborate with someone that you think would help you grow. Other than that, it's totally, completely confidential.
Got you. Guys, if you're just joining in, please, if you have any questions for Barbara, we're talking about therapy and basically, what to expect and what to expect from sessions and how to choose a therapist and things like that. So we know everyone's kind of a little mental drained right now with the quarantine. So if you guys have any questions, pop them into the comments, pop them into the question box, and we'll do our best to go ahead and answer those questions. So I got a question that came in. This is before they knew what your specialty was. Do you ever do couples counseling?
Yes, I do.
So their question was, in couples counseling, is it better to do sessions together or separately?
It depends on, everyone has a different way of doing it. So I generally keep couples together. And then sometimes we will, one person will come, one pass, and the other person will step out. But I keep it even. If I have a session with the wife, then I have the session with the partner. So I just keep going back and forth. But I have found that keeping folks in the room together is what I do. Though sometimes people go ahead and have their own separate therapist with, the couple might have their own separate therapist or may come from having seen separate therapists for a while. So I try and be fluid. It's interesting because in this time of so many rules, like I'm going to see a client virtually for the first time and not see them face to face. So the field is really being challenged to do many different things. So I've got to be really open to that, to the benefit of my clients. It's always, to the benefit of my clients and with their collaboration. What do you think of me doing it that way? So I really try, it's, to move the goals forward.
Absolutely. So this other question, and I'm not sure if you want to answer this or not, but it came in, it says, you as a therapist, have you ever been to therapy?
Well, we kind of call it different things. Well, first, let me go start with how you become a therapist. So that'll
yeah,
help.
great.
Because therapists are, so I'm a licensed professional counselor. The counterpart is also social work licensed clinical social workers. So we are all master degree individuals. So we've gone to 4 years of college, and then we get 2 years of graduate school.
Right.
And then we have our basic degrees. After that, we have 3 years of supervision that we take. So our cases are monitored by a mentor or by a senior clinician. So we have a lot of oversight for up to 3 years. Then we test, and then we can get our license so that we can be fully independently and working as a clinician. But once you kind of get that support, really, of another clinician overseeing your cases, it never grows old. You're always wanting to get asked questions and get support. So to that extent, your cases are always being kind of looked at. How can you, your timing, your cadence, collaborating with other professionals. So that's something that most clinicians have for their entire lifetime. They work coming and going with a supervisor, we call that looks at how we feel about the weight sometimes of working with clients and the joys of working with clients, but always that we're reaching goals, making decisions about when to discharge or when not to discharge. And so we always have that, the clinical oversight or clinical supervision. I'm going to have a group session in a couple tomorrow's Friday. So I have my group clinical supervision. So I get that. Now on the other side, it's a weighty and challenging world, and we're really in the trenches. So yeah, I've gone to therapy many times in my life and you know, kind of come and go to the extent that I feel I need it to really boost my emotional wellness.
Right, because you have to be at your best in order to give your best to your clients, right?
Absolutely, absolutely.
Absolutely. So you so what would be the difference between a PhD or an MD when it comes to therapy? Also, somebody asked, and I'll just mush it in with this question, is if you go to therapy, what was it? If you go to therapy, will I be made to take medicine?
Oh, like never, 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 never. So MDs, the kind of the top of the food chains, kind of in a way, is a psychiatrist. Psychiatrist is a MD, a doctor, and psychiatries can prescribe. Psychiatrists prescribe medication. They also do talk therapy. So some of them really focus on that medication aspect and monitoring it. So they're often the head of a team, you know. So that's the psychiatrist, an MD. The other doctors are PhDs who are clinical psychologists. So clinical psychologists who are also in our field, they're PhDs. So they're also called doctors, but they're not a prescribing doctor.
Right.
So the prescribers are your doctor, your regular primary care doctor, your psychiatrist, and now there's a new class called an advanced practice nurse, who also will do the psychiatric medication if you need it. So that's not necessary, and it's not necessary to see a psychiatrist for talk therapy, but some people do, and some psychiatrists like it, but they often do the management of medications. So your therapist and you will decide if it's time, if it's useful for you to use medication to help kind of move, a sticky depression that might be due to a divorce, due to loss, that can really be due to grief. Grief is a really frightening emotional turmoil that is kind of hard to rise from. So, and it doesn't have to be something you never get over. And it could be that way when grief is very tragic, sudden, complicated. So we want to move that away from it because we don't want anybody's functioning to crash. It's something you can recover from, but it can be hard to recover from. So that's a time when medication might be useful for a period of time, but not forever. Doesn't have to be forever.
Right.
So that's a psychiatrist in collaboration with a therapist, social worker, or licensed professional counselor.
Okay. So we have a comment. It says, many of my college students have called to tell me that they have COVID. They seem so resilient and unworried. Could you comment on the notion of resilience for all?
Well, I guess that's hope. That many, and that's the beauty of youth, that better days are ahead. And I think for us to all really believe that there's still much ahead for us to accomplish, much to us to do in service, I'm really glad to hear that. When I talk to clients, I talk about two things that are important: agility, emotional agility, and emotional resilience. So resilience is to heal all the way through challenges, and that's by what we eat, who we're with, the activities we choose, adequate rest. It's multidisciplinary, it's multisensory, and it's active. It's you're ingesting superfoods for your soul, superfoods for your emotions. So those who have learned that, um, uh, they're good at it right about now, because they realize that they can walk through this. And we're urban dwellers. We're tough cookies. I mean, we commute an hour to work. We got on that train. We walk a lot. As urban dwellers, we take a challenge. We're adventurous, and maybe as an adventurous lot here in Jersey City, we can believe that we can manage this. We can get through this. So it's wonderful that youth, and maybe some hardship. Some of us have had hardship before COVID, so that we know that getting by the worst is possible. We've seen it in our families, and
Right.
certainly in communities of color, there were many bad times that we've experienced. There were bad times here in Jersey City, and this town, always had great spirit, great individual, great bones. So, and a great soul to it. So
Absolutely.
we'll come back again. We've got the resources in the people, the multicultural nature. Since we're multiculturals, we have many traditions of healing. Food is certainly one of them. That's for sure. But there's music, there's gardens, there's ability to bike, there's ability to connect with your neighbors, to celebrate what they celebrate. There's many ways. There's nature. Once again, the river is around us. We can look at the river and look how it flows despite everything.
Absolutely. I think I told you when we were speaking earlier this week that I found some grocery store dried beans in my cupboard, and I put them in a wet paper towel to see if they would sprout. And I think they were 3 years old, and they ended up sprouting. And then I got really excited, and I was like, I'm going to go get some soil and I'm going to plant them and maybe they'll live. And then I was like, oh my gosh, they're growing. And it was just this little bean brought me so much joy every single day to see what was going to happen next. And I was like, you know what? Sometimes it's just the little things, guys.
Sure. And the mystery, the miracle of nature. There's a miracle in
Yeah, it was like, something that was like out of my control, that I was watching just something grow. Yeah, I think so. Yeah.
It's interesting because the New York Times had an article on how to grow scallions. So you can have scallions all the time. And
I have scallions all over my house right now in every jar possible.
So everything old is new. So the baking of the bread, the miracle.
Literally, I baked bread this weekend for the first time.
So keep it up, everybody. Go back to the old, go back to your traditions, and try something new. But I think the goal is to keep trying, so that there is a healer within each of us, and that because we have, as a species, outrun so much, there's a possibility that each of you know what's good for you. Like the therapist can just remind you of that every Wednesday at noon, but you can also come with what you have tried. So don't be afraid to try and heal yourself.
Right.
As an individual. You've probably tinkered with a few things. There's some natural ability within all of us. Sometimes we forget, and sometimes it's stolen from us. There are things in life that are horrible that folks experience by the time they sit in the chair near me, or by the time when we get ready to Zoom. And that's hard to kind of unpack. So we've got to unpack some historic stuff. One thing I say to folks is what helped you survive your childhood is not going to help you thrive in your adulthood. So we've got to look at the task of glancing back sometime in therapy sessions and make sure you're carrying useless dialogues, useless habits into our adult life, and trying to do that, square peg round hole type of thing.
Right, right. So guys, I wanted to let you know that we have about 15 minutes left. So if you have any other questions or anything else that you'd like to ask Barbara or you'd like us to talk about, please, please, please go ahead and pop it into the comments or pop it into the question the question box below. We'd love to hear your questions or just for you to say hi, whatever you'd like to do that's going to bring you a little happiness right now. I will take it back to one of our questions that came in earlier this week. What do you think about therapy animals?
Yeah, I think that if it works for you, and therapy animals, we're talking about, and I don't, that's not my expertise.
Right.
But if folks find joy and comfort from them, then they absolutely should use them,
Yeah.
use them. I will tell you, my mother is now living with us, everyone, and some folks know that. And my cat is so happy. They are best buddies. They're having a great time. They sleep together. And, grandma's, she thinks it's very funny. They're having a great time.
Yeah.
And I think that animals, too bad animals can't write, because they were like living their life. They were doing all kinds of things, and then everybody's home. So for them, kind of like this, for some it's good, and for some it's bad. But if they're bring you joy,
my dogs are living their best life right
right. I think cats are different, but but I know that there is a portal to healing for every one of us, every individual, and us as a collective, so that we can do both. To be individually soothed and strengthened is to also take actions as adults that are going to really serve the human community. So in my workplace, I saw animals come in, and if that makes folks comfortable, and if they're ready to be part of that community in the workplace, then so be it. So be it. So
yeah. Awesome. We have a comment. It says, do you find telemental health counseling just as effective as in-person counseling?
Well, how do I find it? It's hard. I think every therapist that I'm talking to now, my colleagues are saying this is hard work. We are, my therapy session begins when I wave the people in. I've got like this runway. I used to have a runway, and I would wave them down the runway, down the hallway, and they would walk a certain way, and I would see them. And there was a real cadence and a different kind of connection. We are going to have to learn as clinicians. We're a somewhat stubborn lot. I thought my head was going to explode just doing this, but
yeah, but we got on here without a hitch.
Look at that.
Yeah.
Only 3 sleepless nights.
Oh my goodness.
But no, not but we're stubborn, and we are we have become accustomed to this way of dealing with very delicate situations and people that are turning over important areas of their life. So I think I can only speak for myself, not for my field. But I'm working very hard to be effective. And thankfully, I have all older alumni clients. So my clients know me. They know my glasses. They know me. So so I can, but I'm working at their nuances. I'm working at the brows. I'm working at the hair. So I'm going to work at the nuances. And I really, really look forward to the day I can see them in person. So I think we will work differently. I think that clients will need to let us know, give us information that we didn't have before, that we saw. So if you're jiggling or your shoulders are tight, we're going to need to start asking different questions. So I think that no therapy is awful for those who want it. So those who want it, if this is the way we do it, clinicians have always found a way. I've worked in closets. I've worked without air conditioning. I've worked without heat. So I'll work with this too. It's a challenge, but I'm going to do it.
Because you're from Jersey City.
Because I'm from Jersey City.
Because you're from Jersey City, and you can make it happen anywhere.
I will make it happen, but particularly for urban dwellers who are a tough, resilient crowd,
Absolutely. Oh, someone said all of your advice and expertise is so good to hear. Your soothing voice too. I like the way you have made me feel lighter in the last hour. Thank you so much.
Well, thank you, Beth.
Beth, she's fantastic. Okay, so we have about 10 minutes left. So I'm gonna ask you, let's see. Um, is there a way for, if I was gonna come see you for my very first therapy session, is there a way or anything that I need to do to prepare myself, mentally prepare, physically prepare, anything I need to do before I come in?
Well, you might want to have a question like, where would I like to be after 6 sessions, and where would I like to be after 12 sessions? Um, and
Have a real talk with yourself.
yeah, have a real talk with yourself. Try not to be hungover. You know, don't.
And are you speaking from experience that that's happened?
Probably, you know, probably. Um, but I think it's an anxious.
Well, I guess you don't know what people are walking through in that moment
Yes,
of their life. So
it's a really, really hard time. And also, I guess, be open to hearing things about yourself that maybe you haven't heard before. Hopefully you want the clinician to tell you something different, not the same. Like so I'm not here to kind of sign off on poor behavior or things that aren't going to get you as a client where you want to be. I'm going to go shoulder to shoulder with you and kind of help you be part of your team.
Right.
So there might be things that are hard to hear. There might be things that make you angry. You might feel angry. You might really hate being in the room with me. And that's kind of that relationship, that density of relationship can be off-putting.
Yeah.
You know, no one's maybe heard your truth, and no one's maybe responded to you in a way that made you feel heard. So a lot of stuff can be blowing through the air, and hopefully all to your healing, all to the best way of functioning that you can. So even though it's difficult and dense and troubling at moments, I always try and leave somebody. One thing I try and leave every session, or kind of ask someone, is what's the takeaway? As part of my, and phrase, because I want to know what the person heard. And if they're hurt or discouraged, I want to say something that lets them leave truly lighter, truly hopeful, and
that really resonates. The fact that you can say something and what they hear is completely different.
Oh, sure. Yeah.
So the fact that you do that is just really fantastic. Reconfirming that your message got across and the correct, emotion is being given over.
Yeah. I don't want people to, I don't want them to feel worse. Though there are times, I hope that, like you said, it's incremental. And if they come in at a 0, if all I can get is a 3, then, that's it. But the hope that you're going to come back and 3 is good, stay at a 3, keep that 3 up. That's where you were. That's good enough for today. And I'm, if you find a crash, then you gotta come back and talk to me. Give me a call if you need to. But I'm available for clients.
Oh, of course you are. Of course you are. So I don't have too many questions left right now. So guys, we have about 5-10 minutes left right now. So if you have any other questions that you want to ask Barbara, she's here to talk about we're here to talk about therapy, what to expect in sessions. We will have this live stream up in our Everything Jersey City story for the next 24 hours. So if you've missed anything, you can always go back and check out that story. We also always post it on our YouTube channel for Everything Jersey City about a day or two after the session is over as well. So we have a lot of stuff going on, ways that you can tune in and hear our live streams after our live stream ends. So don't worry. We can see Barbara as much as we want. So guys, a lot of people sometimes think that therapy is outside of their means, their financial means. So how would that work for someone? If somebody knows I really think I need therapy, and their one stop in their head is, I don't think I can afford it. How would you have them move forward?
I think attempt to negotiate. Colleges, so college students, anyone who's a college student should be using therapy. Get to your therapist if possibly can. In Jersey City, in Hoboken, there's a community mental health center, which is affordable and takes most insurances. And Bayonne also has a community mental health center. So those are both affordable and also take like Medicare, Medicaid.
Mm-hmm.
Also, I think ask. I mean, this is something that is an investment in yourself.
Mm-hmm.
And all therapists, their kind of working clients come at night, or those who used to work came at night, and now that's all changed. So everything's upside down. I think call a couple of therapists. Psychology Today is one place to go and look for therapists, and then ask. And be committed to it. And ask for what you can afford. So we aren't spending money. I'm not spending money. No one's spending money very much. So consider it. It's an investment.
Mm-hmm.
And you can, have your 2 sessions together, your assessment and your second session, and then you can go every other week. I have clients that come once a month. They're my alumni. They're my long timers. They come once a month. So when you look at how you're going to spend your resources, just consider it. It's not cheap. I'm in the field, so it's just hard. It's hard, but I think that.
But I think that's some great advice. Ask, utilize your Medicare, Medicaid, or insurance, and utilize, if you're a college student, utilize your college therapist.
College therapy center, yeah.
Therapy center. So I think that's fantastic. I think that you did an amazing job answering that question, given the fact that I think it is kind of hard, since it is your field of work, to answer that. So thank you so much for that honesty.
And also, IPG are, a therapy group that has been in Jersey City since 1982, 84. They're who I've worked for 20 years. And, they have the junior therapists that have some reduced fees. So some therapists they might have on their website have reduced fees, and IPG is one of those places that has reduced fees. So it's really about making a commitment to your therapist, as that's their time, and they're giving you a sale price for, like, not just for like Columbus Day, it's a sale price for the whole year. So what I ask is, when my colleagues do that for you, to show up and pay them. So that's your commitment, to be able to do the long-term work. So sometimes they have students in community mental health centers, and they can offer, $50 to $85 to work with a student who's being supervised. So ask about those reduced fees, and then you as the client make the commitment to show up.
Absolutely. So we have about 4 minutes left, and I always like to end these live streams with a Jersey City shout out. You are a Jersey City native here. You live in Jersey City. So just take about 1 minute if you want to, and we like to shout out any local businesses that you think are fantastic, who could really use a shout out right now in Jersey City, whether that's a place you like to eat, shop, anything like that. We just like to shout out our local businesses.
Lovelock, Raza, Shadman, who I don't know if they're opened yet, but hopefully they'll open soon. The all-you-can-eat Pakistani food, hot.
Ooh.
Hayes and Basket, George and his wife Kathy, who do all the plants, the drive-by plants. The 14th Street Garden Center, this has a drive-by business right now. Let's see. Left Bank. We love Left Bank hamburgers, right?
Oh my gosh. Oh gosh, do I want to hamburger now? You
can tell I'm a foodie. Raza, thank you. Key Foods. We love you, Key Foods.
We love Key Foods too. All right, guys. Well, guys, this has been our Everything Jersey City Experts live session with Barbara Hines. She is here, a Jersey City native. She went over and talked about a lot of different things that we can think about, and answered a lot of questions about therapy and how to choose a therapist, how to know when you should go to therapy, and what to expect in sessions. We covered so much and answered all these questions. This live stream will be up for the next 24 hours in the Everything Jersey City story, so you can check it out there. And in a day or two, we also will get this up on YouTube, so you can watch it whenever you want.
Don't forget Madame Claude's and IPG and anyone I've forgotten. I really, really apologize, but you know, this is all I got.
I know I kind of put you on the spot there, but I always just like, you know, everything Jersey City is all about celebrating the goodness of Jersey City and highlighting people in Jersey City. And it wouldn't be a Jersey City live stream if we didn't shout out all of the places that we appreciate here in Jersey City. Ooh, oh, yep. We got some people talking about some stuff. Oh, somebody said Madame Claude's.
Right, Madame Claude's and Rustique. Don't forget Rustique. That's kind of the Hamilton Park area.
Yeah.
Hamilton Park, Hamilton Inn. So, and oh, and don't forget Crown Fried Chicken. I mean, Crown Fried Chicken is the joint. You got to go check it out.
Oh, what are you doing to me? What are you doing to me?
It's good news and bad news.
I know. And, you know, I don't live too far from it. Like, I could walk there in about 5-10 minutes. So this is dangerous. All right, guys. Well, it has been a pleasure talking and sitting down with all of you guys today. Barbara, thank you so much for taking the time to do this. And, guys, we'll catch you next week on another live stream.
Wonderful. Thanks, everybody, and goodbye.